Hi, everyone. Um, I'm Wendy Strout. I use she, her pronouns, and I am the Wisconsin State Director, so just one state over. And very excited about all the successes that we're having in Wisconsin, but very happy to be here, and I was very honored to be asked to moderate this panel. And I wanted, before our panelists introduce themselves, wanted to just kind of set the tone for what we're hoping you walk away with from this panel. We want you to be able to understand the unique political, cultural, and social currents that are impacting LGBTQ plus youth at home, at school, in systems of care, and in the broader community. We also want you to know, how you can take your practice and your advocacy to the next level to really make sure that we are doing our best to fight for LGBTQ plus youth. So with that setting, I'd like to ask our panelists to introduce themselves, starting with Sarah.
Hi all, I'm Sarah Warbelow. I use she, her pronouns. I'm the Vice President for Legal at HRC.
Okay, I'm Hildie Edwards. I use she, her pronouns. I'm an HRC Youth Ambassador and a performer, yeah.
She's not kidding, she's an incredible performer. My name is Dr. Kade Goepferd. I use they, them pronouns. I'm a pediatrician and I serve as the Chief Education Officer and the Medical Director of the Gender Health Program at Children's Minnesota, which is our local freestanding children's hospital here in the Twin Cities.
Hey, good morning. My name is Jordan Mix. I use they, them pronouns, and I'm the Director of Educational Programming at an Iowa-based nonprofit called Iowa Safe Schools. I work with K-12 educators across the state to provide professional development and other services to help them better understand and meet the needs of LGBTQ students.
I'd like to acknowledge that, unfortunately, Senator Quaid could not be with us today. Senator Quaid is fighting the good fight in the legislature. They are still in session, but please go and read her bio. She's done some amazing work. So I wanted to acknowledge that, and I know she sends her regrets. So we would like to kick this off with, Sarah, I have a question for you. So we want to look at the bigger picture of this region's landscape. You've got, great states like Minnesota and Illinois that have some great pro-equality laws on the book. You also have my state, a battleground state, where we have a divided government. And then you have a state like Iowa, who's unfortunately passed some pretty anti-LGBTQ plus legislation. So from your perspective, what trends are you seeing in this region, and how would you describe the landscape for LGBTQ plus youth here?
Yeah, thanks so much for that. So let me start by acknowledging that we are really in a particularly special place here in Minneapolis. Minneapolis was the first city in the country to adopt non-discrimination protections not only for sexual orientation, but also gender identity in 1975, okay? So when people tell you that being trans is new, Minneapolis recognized in 1975 there were trans people who needed protections. And every single state in this region that we're discussing here today has non-discrimination protections at the state level for sexual orientation, and all but Wisconsin also have them statutorily for gender identity. Gratefully, Governor Evers has interpreted the state non-discrimination law to provide protections for transgender folks, which is an incredibly important step, but not the same as those guaranteed non-discrimination protections. But that, unfortunately, is where the similarities stop. Instead, we are seeing this incredible divide between these four states. You have Minnesota and Illinois who are really trying to move forward a pro-equality agenda, attempting to adopt laws to protect doctors who are serving transgender youth, put in place bans on conversion therapy, and the legislatures in Iowa and Wisconsin are incredibly hostile to LGBTQ people, particularly trans youth, and are attempting to move forward everything from bans on medical care for youth to curriculum censorship bills. And it really is a microcosm of what we're seeing all over this country, right? So these 4 states are not unique, but really representative of the incredible divide that we're seeing today. And we expect to continue to see states doubling down on bans on gender-affirming care for minors. Don't be under the misimpression that somehow there is a saturation, right? I've heard people use this term, like somehow the bad legislators have done what they want to do and that's the end of it. They have decided that attacking LGBTQ people, particularly trans people, is salient, even though all the polls show that it's not, right? The American public supports transgender youth. They're running away from abortion. That was their boogeyman for a long time, and now they're trying to make trans youth their boogeyman. So it's incumbent on all of us to push back because A, it's the right thing to do, and B, we have to help them understand that it is not politically salient.
Thank you. So, Hildie, I would love for you to help us understand the impact on youth like yourself. Like, how has the rise in anti-LGBTQ plus legislation affected you? And like, what is it like being a young transgender person in Minnesota, especially?
Well, I feel very lucky to live in Minnesota. I know that I know so many trans children across the state who are in Texas and in Florida and are facing so much hate and like the horrors, you know. So, and that is really heartbreaking. It's really sad. I do feel kind of trapped here sometimes. I feel like there's certain places I just can't go anymore. And that, of course, also doesn't feel good. When it comes to the youth, however, it's like we have the whole world in front of us. We see all of this on the news. We see it on social media. So I feel like a good portion of students where I live have just adopted into the fact that it is normal when it's not. So it's hard. It's hard right now, but it's hopeful. So we have that, and we're in Minnesota, and that's great. And I'm really happy that I live here.
Yep. Minnesota's a great place to be, so that's yeah. At least you're here, so I appreciate that. Well, Dr. Goepferd, I mean, as a health professional, you know, what are you seeing from your patients, especially the impact of this anti-LGBTQ plus legislation, and like overall, what are you seeing on the health and well-being of LGBTQ plus youth and really the whole community as a whole?
That's a small question. So, I mean, on a very kind of logistical level, when you ban access to health care in states that surround yours, our country doesn't have a nationalized healthcare system. We build our healthcare in this country state by state. That means we base it on the populations that are in those states and for the services of those communities. So when whole groups of people can't access the essential healthcare they need where they live, it creates incredible burden on those states who do have those services available. So just on a logistical level, we already had large numbers of families waiting long wait times to get into our gender health program prior to the states around us enacting bans in 2023, and we've only seen that increase, which means it's harder for kids here in Minnesota to get health care they need, and of course it's incredibly hard for kids in surrounding states to get health care they need. In terms of how it's impacting young people, I thought I would just tell you 3 brief stories because I think that when you're not in the exam room, when you're not in the classroom, when you're not hearing these stories, I think sometimes we forget how woven into the fabric of kids' lives some of this stuff is. So the first story I'm going to tell you is about a 6-year-old girl who I saw in 2019. So there was no healthcare bans in place at that time. Her and her family drove all the way from South Dakota to Minnesota to get care in our clinic. So they, for those of you who don't know, that's kind of a long drive. So they drove here, they stayed overnight in a hotel, they came to see me in the clinic, and at 6, you know, what we are able to offer kids and families in a comprehensive gender health program is essentially support, answers to questions, information about their child's development, help with those kinds of things. So no medications, no specific medical interventions, but they had driven all that way because their 6-year-old transgender daughter wanted to play soccer. She didn't want to play soccer in Minnesota. She wanted to play soccer in her small town in South Dakota. In order to play soccer, they had to submit a birth certificate. On that child's birth certificate, she was identified as male and had a different name, and no one in their community knew that their daughter was transgender. They were terrified what would happen if anyone in their community found out that their daughter was transgender. They asked their local pediatrician to help them complete a form to amend the birth certificate, and he refused. They then went online, found us, and drove all the way to the Twin Cities so that their 6-year-old could play soccer. So that has nothing to do with being able to access health care. That just has to do with being a kid. Then I had a 9-year-old who that same year, this was the year that we opened our program in 2019, came in, was around the age of puberty. We spent a lot of the visit talking about puberty, which is every young person's favorite subject to talk about. So talking about puberty and body changes and sort of what options we have to pause or delay puberty and what that means. And so we were kind of talking through all of this stuff, you know, everything that's happening in the kids' school, all of this medical information, really, you know, intolerable for a 9 or 10-year-old information about bodies and puberty. And we got to the end of the visit, and I said to her, is there anything that you have questions about, something I didn't answer, something you didn't understand before we wrap up the visit today? And she said to me, in 2019, so you know who was the president at that time, was told not to mention political candidates by name. She said to me, is the president going to take me from my family and put me in a cage? And once I got my breath back, you know, I realized that at that time she was hearing a lot about young people at the border and what was happening to them as they were removed from their parents, at the same time that she was beginning to hear a lot of rhetoric targeting trans youth. And she was scared. And her mom had never heard her ask that question before. She didn't even know that was something that was like keeping her up at night. So our young people are listening, they're watching, they're hearing everything that's going on, and they are internalizing all of these things about what may or may not happen to them in the future. And then the last story is about a 14-year-old who I've been caring for since he was about maybe 7 or 8 years old. He started puberty blockers maybe a year or two ago, so he's been on puberty suppressing medication, and will be probably moving towards starting testosterone in the next year or so. But he and I were interviewed for a national TV program through NBC Online, and they had wanted to talk to a young person. And when they were talking to him, they said, what does it mean to you that you can access the medical care that you need here in the state of Minnesota? And he started talking about it and how affirming it was to be able to access puberty suppressing medication and the anxiety that he felt as his chest had begun to develop. And then he started crying. And when the reporter asked him what he was feeling, he said, I can't stop thinking about all of those kids out there that are like me that can't get the medication that they need. And he was 13 at the time. And so, you know, kids like Hildie knows that she lives in an awesome state. She has amazingly supportive parents. She has done a lot of work herself to make Minnesota the safe and supportive state that it is due to her advocacy. And she knows, and she is friends with, and she has relationships with kids who can't get the health care that they need and deserve, and don't get the health care that they need and deserve, and that hurts. And so this is really hurting all of our kids in very profound ways. And it's hard for me to just say that without sharing some of those stories with you, so thank you for indulging me in listening to those.
Thank you for sharing those stories. Well, Jordan, so we know that safety and inclusion at school is a key determinant of LGBTQ plus youth well-being. We also know that the political and cultural climate seeps into the halls and classrooms of our schools. So what are you seeing, hearing, and feeling right now in schools in Iowa, and what is the impact of the legislation in schools?
Yeah, that is a loaded question. So it has been a, shall we say, challenging year or so in Iowa politics, and that would be putting it very lightly. I see my Iowa delegation of teachers over here, so thank you for sticking it out with your students this last year. So Iowa works on a part-time legislature, meaning that our lawmakers are creating and passing laws from January to roughly mid-April. That time goes back a little bit depending on how long it takes them to approve the budget and things like that. But in 2023, about halfway through the legislative session, they passed 2 laws in mid to late March. Those 2 laws were a gender-affirming care ban for anybody under the age of 18, and then a law requiring that any person who is inside a school in Iowa who is using a multi-use restroom or locker room facility must use the facility that aligns with their original unaltered birth certificate. Now, normally, when laws are passed in Iowa, they don't go into effect until July 1st. But these 2 bills that were passed into law on the same day, March 22nd, had immediate enact clauses, meaning that they went into effect as soon as the governor signed them on March 22nd. So students literally went home from school Tuesday afternoon and came back to school Wednesday morning in a completely different world. And that Wednesday morning was one of the hardest times in my professional career. I was immediately that morning in an all-principals meeting with Des Moines Public Schools, sitting with people who had been education professionals for 20, 30 years, and everyone was just sobbing, myself included, in front of all of these principals and lawyers. And the tone that day was obviously very somber, very where do we go from here? Des Moines Public is in a unique position where they have a lot of infrastructure already in place to kind of help move through changes like this. But that was not the case with every district across the state that I was working with. And then all of those things were compounded a little bit later in the legislative session when our legislature passed an overwhelming overhaul of educational support that educators could provide to LGBTQ youth across the state. This bill was like 40 pages long. It certainly affects students who are not LGBTQ, but it very much targets LGBTQ students. And it does things like require that any school official, like that school administrators report to parents and guardians when students make an accommodation request meant to affirm their gender identity. No, they do not explain in the law what they mean by a request for an accommodation. They require that any books in district library programs containing any sex acts be removed from shelves. They don't allow any mention of gender identity or sexual orientation in K-6 classrooms. So they limit the ways in which we can survey students about the ways laws like this affect them, and that went into effect on July 1st. So by the time students and teachers got back to school in August, the number one thing, if I could sum it up in one word, what I was seeing and hearing and noticing was uncertainty. Educators, very unclear on what they are and are not allowed to do, very unclear on the degree to which their administrations or the teachers union can protect them when they uphold the ethics that their profession requires of them, even if it violates this particular state law, which, by the way, is confusing because Iowa does have protections for people regardless of sexual orientation and gender identity in our civil rights code, and we have since 2007. So that makes all of this even more complicated. And then students have no idea which adults they can trust. The students who don't have affirming families had largely been able to find a handful of teachers in their buildings, GSA advisors, English teachers, whoever, who saw them for who they were, could affirm them, right? And now we're suddenly in this position of, do they have to call my parents? And that uncertainty has been one of the hardest things to witness, and it's hard as someone whose job it is to help try to clarify those things because you can't right now. Everything is so complicated. There have been lawsuits which are putting injunctions on pieces of this law, but not all of it. So it's been tough. It's been uncertain. But I do want to just honor the really incredible work coming out of so many student groups across the state of Iowa. They have proven to be phenomenal activists who are certainly not going to let their home go in this direction without a fight.
Thank you for sharing that. Well, Sarah, I mean, we have heard some heavy stories, and I know, I'm sure people out here are really wondering how they can really advocate on behalf of LGBTQ plus youth, but may not know where to start. So, we know it takes all forms, but can you speak to steps that folks can take to get more involved and how to tailor their advocacy to their specific roles, their strengths, and even their limitations that they might have?
So a couple of things here are really important. First is make sure that you're following what's happening in the state legislatures. You can do that through HRC, and in addition, I would also encourage you to be following the incredible work of the state equality groups all over this country. Folks like Out Front Minnesota, One Iowa, right? There's really amazing local groups that are doing incredible work, and they can help plug you in as we can to what is happening, keep you up to date. We need people to show up as the professionals they are. That doesn't mean if you're a mama bear, you shouldn't talk about your kiddos and how important that is, or if you yourself are an LGBTQ person, how it impacts your life. But we know that lawmakers respond to individuals who are going to be directly impacted as professionals. So whether you're a teacher or a school administrator, whether you're a healthcare professional, showing up in that capacity really does change minds. We have Republican lawmakers who have switched their votes after hearing from professionals about the impact that these laws would have on them. Because the truth is, LGBTQ equality should not be a political matter, right? It is a human rights issue. We have a long history of bipartisan support for LGBTQ people. So we just need to help people get back into that cycle. And for those of you that are in educational spaces, I also want to remind you that Title IX provides protections for LGBTQ youth. We have a brand new federal regulation that was just released that really emphasizes that. And you can file a complaint even if you were not the person who experienced the discrimination. So if you witnessed discrimination, you can file a complaint with the Department of Education Office for Civil Rights. And that is a great way to support young people who are not necessarily going to know what their rights are not necessarily going to feel empowered, may not have parents who are going to be supportive of them filing a complaint. You can do it on their behalf, and the Department of Education will get involved.
Great, thank you. Thank you. So Hildie, from your perspective, what are the most important and impactful things an educator or another adult ally can do to support LGBTQ plus youth like you right now?
Generally just be loud, show up, because silence is clearly not going to get us anywhere. We've been silent for a long time, and look where we are right now. So yeah, speak up. Protect your students from anti-LGBTQ bullying. If people on your staff are being not good, call them out. Even if you just put up like a safe space sticker in your classroom, that makes your queer students feel safe. Go to rallies, make social media posts, amplify Black trans voices. Literally do all the things you can do in your power. And that will be very helpful. Also, just listen to the trans youth too. I have dealt with so many people who feel like they know what they're talking about and just ignore the youth's voices when really we're the ones experiencing it firsthand. So really just listen to us and let us take the lead.
Thank you for that. Thank you. Dr. Goepferd, so for the adults here who are not health professionals, what advice would you give them in supporting LGBTQ plus youth in this moment, given all of the anti-LGBTQ plus legislation, maybe not in Minnesota, but in your neighboring states, and how do you see the impact on LGBTQ plus youth of this rise in attacks, even if, they're in Minnesota or Illinois, like a good state? How do you help them with this?
I think as a pediatrician, one of the things that drives me to do what I do is that I really fundamentally believe that all kids deserve to thrive. And that's why I became a pediatrician in the first place, and my interest in caring for LGBTQ plus youth, and particularly trans and gender diverse youth, is in the service of making sure that they can thrive. And I've been talking about LGBTQ youth and their health care and their well-being for 20 or more years now, doing trainings and talking about this. And as Sarah was talking earlier, I kept thinking, all of the things that I talk about as protective factors for LGBTQ youth, things like parent support, things like school support, things like peer support, being able to join sports teams and other school activities, things like having teachers at their schools and counselors that they can talk to confidentially, things like having access to credible online resources and books. All of those protective factors are being systematically taken away from our young people. And it's not coincidental that that is happening. And so what we can do as adults and as a community is rally behind those protective factors. Make sure our kids can participate in the peer and school community and school activities that they need to thrive. Make sure that we're standing up for each other as teachers and school serving youth serving professionals in schools and other places to make sure that kids know who their safe spaces are. Make sure that kids can get to healthcare providers if they need to. Make sure that we stick around, so we're here to help care for kids. And then, one of the biggest protective factors for any kid is a single supportive adult. And so you can all be that single supportive adult for a young person, but you can also show up in your community as a role model and as an example of someone that young person can be. I think in this climate of anti-LGBTQ legislation and anti-trans legislation, and even this morning, it's like story after story of heartbreak and all of these things that are being taken away, of uncertainty and confusion for educators and young people. And we forget to celebrate the amazing gifts of our community and the amazing gifts that we bring to the table. So share your joy. Let's let trans kids see trans joy. Let's let trans kids see themselves in pediatricians and in educators and in lawmakers and in, legislators at the Capitol. And, I think that the work I do in pediatrics is really important, but I don't think it's any less important than the work I do coaching my son's basketball team. Like, that's important work too. I need to show up in my community. I need to be the basketball coach as much as I need to be the pediatrician. I need to be an example, and all of us can be that, of what it is to thrive as an LGBTQ adult, because we can't let our young people be left in this hopelessness. And that's probably, to me, the biggest thing that they could take from us, is our joy and our pride and our sense of self. And so I think not forgetting to show up with that for the young people in your communities and in your lives.
Thank you. So Jordan, from your perspective, how can the people in this room engage in the political landscape? Like, how can they get involved?
Yeah, that's a good question. So the truth of the matter is that the folks who are really advocating for a lot of this very harmful legislation, the folks who are voting on it, the folks at home who think that they support it, have a really intense misunderstanding of what it actually means to be LGBTQ, right? And the people who are behind this legislation, who are pushing for it, who are writing the bills, who are oftentimes themselves not actually your elected officials in the first place, they are really capitalizing on this idea that people who they're speaking to don't understand what's going on, right? So one of the most important things that I think educators can do to really sort of insert themselves in this political landscape is to utilize the stories that you have from your own experience and understand that one of your most powerful scopes of influence here is to be the experts on how this is playing out in schools and in classrooms, right? Whether that means speaking up at school board meetings or on your own personal social media so that the people who already are in your circle who respect you can see how this is affecting you and your day-to-day and the children that you protect. Whether that means engaging in larger community events, which, as some other folks have said, I think is a very important avenue to be exploring right now, especially in states like Iowa. the government right now is not really going to save us, right? Courts move slowly. There are lawsuits happening, but years until we're going to see some kind of resolution there. And even then, it might not go in our favor. So I think in the meantime, really focusing on those community spaces. How can we encourage city councils to hold, learning sessions on having their constituents understand the rights that they are afforded? How can we practice with our students actually speaking to elected officials? How can we teach them about that process? For those of you who are in educational spaces where it would be appropriate to teach about civic engagement, I think that is very helpful and important, because even though many of your students are not of voting age yet, they still have a voice that they can use, and we are seeing that right now with high school students and middle school students all over the country who are engaging in protests like sit-ins and walkouts. My niece is a 15-year-old high school student in Yelm, Washington, and they just did a walkout to reject a lot of the cuts that were coming to funding for different programs at their school, right? The students, if we let them lead, they will. What we can best do as the adults who support them is help them build the tools they need to be successful in that leadership. So I think, yes, continue to talk about politics. Yes, be involved in your school boards and your city councils. Those local elections are very important. But I think also knowing that your students very much know what they need, and what they need from you is to listen and help them build the skills to help them be successful.
Thank you. I'm going to go off script just a little bit. Since Senator Quaid wasn't here, Dr. Goepferd, you and I talked a little briefly about this. Can you just talk about, how the coalition it took to get Minnesota to be a pro-equality state? That it didn't just happen with just one organization or just Senator Quaid doing what she could do. Can you talk just briefly about the coalition?
Yeah, I can try. So, first and foremost, there has been an LGBTQ sort of movement and visibility and sort of liberation or civil rights activism happening in this state for a very long time. So nothing like what happened this last year in so many ways in the legislature happened overnight. I think there's a combination of factors. One, we as a community have to be represented at all levels of government. So there are, Senator May Quaid couldn't be here today, but representatives like Lee Finke and others who are in legislature representing our community, we need more of us. I have talked to a lot of people who represent local politics. They're no better at it than you. So, if you have any interest in getting involved in a campaign and getting people elected to, your school boards, but also into, state representative positions, we need a coalition. So in Minnesota, we have the Queer Caucus, the Queer Coalition, and so they have worked together and along with other DFL folks to put together an agenda of what's important to LGBTQ Minnesotans and what do we need to work for. That happens hand in hand with community groups. So groups like Outfront Minnesota, groups like Transforming Families that are supporting youth in the state, groups like the educational associations here in the state, and then pulling in professionals. So when we go before our legislature to talk about the importance of why we need these types of laws and why these types of bills and protections are important, we need, like you were saying earlier, Sarah, we need teachers, we need doctors, we need, parents. We also, need people who are representing the community that they are supposed to be serving in the state government to say, this is really important and this is why we need to do this, and we can share our expertise with you. So I think it takes a broad-based coalition at all levels, but I can't underemphasize, and I think the Queer Equity Institute is going to be here today presenting really the importance of not just voting, but getting our representation in office.
Thank you. So we've coming to the end of our time, but amazing panelists. Thank you so much. Let's give them another round of applause. So as you go throughout your day to day, you're gonna hear from some amazing speakers. You're gonna learn a lot in your workshops. I want you to as you're going through today and as you go home tomorrow or later tonight, I want you to really think about what you've learned here today and take away like how you can take your advocacy to the next level. Whether it's getting involved in running for office or showing up for rallies, being loud. I think one of the most important things I'm taking away from this is like making sure that we're listening to our youth. Making sure that we're listening to them and letting them lead because they know how to, but they've shown it. And so I hope that you're taking that away and like thinking about how can I take this to the next level? How can I take this to the next level to protect LGBTQ plus youth? And I would be remiss, being from Wisconsin, if I did not make a football reference. So even though our team, the Packers, are the superior team, I do have to say that Minnesota and Illinois really are, the champions when it comes to really protecting our youth. And so I just wanted to, acknowledge that and know that the rest of us are looking to you and leading and letting you lead us. So thank you so much. And again, thank you for our amazing panelists. So thank you.